Children and opioids studied, find out who's most at risk coming up. Hi, I'm Allie Cook. Today's November 16th, 2016, and this is your Wednesday Watch. Here's today's dental news. Young children and teenagers are increasingly likely to be poisoned by opioid painkillers prescribed for other family members, according to new research. The study reports that the rate of children hospitalized for opioid poisoning increased 165% from 1997 to 2012. The rate of toddlers hospitalized more than doubled, and teens are also at risk of overdosing. In fact, of all children, this age group is most likely to be hospitalized for opioid poisoning, and in this case, it may be deliberate. Researchers suggest this is because teenagers are at a high risk of depression. Certain experts are calling for new approaches that address overprescribing and safe storage of these painkillers. But some doctors aren't so sure, saying the list of topics to discuss with patients is long enough as it is. The American Dental Hygienists Association has released a new white paper that underscores the ability of the dental hygienist to perform hygiene diagnosis as part of the oral care team. The ADHA says that diagnosis is an essential part of the dental practice, yet confusion exists on how to implement it. As a result, this paper was created to help hygienists understand and use diagnoses in their daily practice. In addition, the organization is providing tools and resources for educators to teach dental hygiene diagnosis to students. To view the paper, visit adha.org. Coming up, the FDA's new designation for silver diamine fluoride. In previous broadcasts, the Wednesday Watch has brought you news about silver diamine fluoride, the caries arresting agent that can be used for patients of all ages. The US FDA has announced that Advantage Arrest from Elevate Oral Care has been granted its Breakthrough Therapy designation. This designation signifies the FDA's effort to address a life-threatening medical need for which there is no available therapy. It's designed to expedite the development and review of drugs intended to treat a serious condition. This designation was granted based on the FDA's review of 10 worldwide clinical trials. These randomized trials evaluated caries arrest in children aged 3 to 9 years and adults aged 60 to 89. Approximately 1,500 subjects were monitored between 1 and 3 years. Thanks for checking out the Wednesday Watch. Stay tuned next week for more news from Dentistry Today and DNN.